Welcome to the Caregiver Hour on 1250 WINS WHNZ, offering support for those who care for a loved one. A show that cares about you and supports and encourages you, the caregiver. Here's your host, Kim Linder.
Good morning, everyone. I am so thrilled to be here on the Caregiver Hour radio show with you. So many caregivers have been calling me, emailing me, texting me, and letting them know how much they love the show and depend on it to help them create balance in their lives. So I am so grateful. So thank you so much for all that loyal listenership and really allowing us to come into your home, into your heart, and really help you create that balance. Really having the information, the resources, and the guidance every day for you. It's available, if not on the radio show. We're now podcasts where you can listen to us anytime, but now you can see us live. It's so exciting to see you and for you to see us. And this is really a big investment of time and energy and talent from all of us here at Clear Channel and Tampa Bay Multimedia. And we really wanted to make this show feel alive for you, to give you energy, to give you information, to make it feel like, you know what, Kim's my new best friend. And she can help me, and we can. The helpline, the caregiver helpline, is your way to go. You want to call this number. You want to have it in your wallet, in your phone, on your desk. You want to have it on the refrigerator. It is a toll-free number that is available 24/7. You can get to us. You can get to me. You can get to our experts. And that toll-free number is 1-877-552-4950. I have done all the homework for you. I have checked all of these different experts for you so that when you call, you know you're getting the best quality home care company, chiropractor, elder law attorney, financial planner. I have them for you. And so again, that toll-free number is 1-877-552-4950. So if you're a caregiver and you're feeling stressed out, or you're a caregiver and you are seeing your parents starting to be confused, mildly confused, you want to call the helpline. Again, that toll-free number is 1-877-552-4950. And I know caregiving can be very stressful because I'm actually in the middle of it. My husband has a cousin, Joy, who is in the middle of caregiving for her mother, who is 90 or 92, and she called us last week and said, Kim, I need help. My mother is acting aggressive and agitated at home, and sure enough, some things medically happened for her. They called 911. They got her to the emergency, and she's been in the hospital, and now she's in rehab up in Philadelphia. And on my way to the station this morning, I'm calling Cousin Joy to see how she's doing, to see what they need. And you know, she is in a rehab now, so the question I was asking her is, have they done the assessment yet? Have they talked to you about putting a care plan together for her? Have they set up that meeting for you? These are the things that I know that I can help guide you as a caregiver of what to ask when your loved one is going into a rehab center. And then I said, do you know if you can get your mother's hair done? Because I know my Aunt Arlene likes to get her hair done. And, you know, Joy said, you know what, I talked to them about getting her showered and washing her hair, but getting her hair done is a great idea. So, you know, just sometimes someone on the outside can actually guide you and ask you and support you. And so that was one. And then the other is really more critical. And this is my sister-in-law, Andrea, who I talked about last week. And I do want to thank Lisa Lawrence from Assisted Transitions, who personally asked me this week when I saw her how she was doing. And I would really appreciated that. So thank you, Lisa. And we were, you know, things were going really well, but then all of a sudden over the weekend, not so well. She pulled out the tubes that were supporting her, and she got agitated, and now she needed blood transfusions. And I'm not sure what that all means. And so I just want to let you know that caregiving can happen in a moment, in an instant, as Lee Woodruff would say. And I feel like I'm in the middle of supporting really my husband, Jack, who is emotionally involved because this is his sister. And I just want to let you know that I appreciate all the prayers. So if someone can say a special prayer for Andrea and her family, I would greatly appreciate it. But this is just really a tough time for us. So we had a tough weekend. And so if you're a caregiver who's losing sleep, like I'm up in the middle of the night thinking about Andrea, praying for her, thinking, what questions do I need to ask? How can I support the family? I can relate that. That's very something that we could relate to, because if you're a caregiver and you're up in the middle of the night, you're losing sleep. And that's not a good thing, because we need to be fresh and recharged for our loved ones and also for our family members. So just to let you know that I'm here for you. I'm like you. I'm a caregiver, and I want to help you. But this helpline is really the way to go. We've got great sponsors who are experts who I've checked out for you. Again, that toll-free number is 1-877-552-4950. But we've got a great show today. Yes. It's Live Your Best Life. Wow. I love when someone says that. And I know Oprah uses that line in her magazine, and we decided to modify that to add benefits of integrative care. And this is great because we've got two wonderful guests. We've got Dr. Ben, who is a chiropractor and owner at Accident and Anti-Aging Clinic. And then we've got the wonderful Tina Costa, who's an RN and area director at Arcadia Home Care and Staffing. And just bringing from those two perspectives, what does integrative care mean for you, the caregiver, and your loved ones? So I'm so excited. We've got a great show today. You can always follow us also on LinkedIn, Facebook, and Twitter. Just like us, and we will like you back, and we can start having a conversation. If you're watching this show live, which I hope you are, you can also iChat us right now during the show. So if you have a question for me or Dr. Ben or Tina Costa, you could do it right now, and we can take care of that right during the show. But if you're just listening, because I have one of our caregivers who called me on the helpline last week, who I spoke to this morning, you could call us toll-free now while the show is live at 1-877-897-8255. Again, that number is 877-897-8255. This is a great number to have in your phone so that if you're on the treadmill, because this caregiver is actually at the gym working out, and then I'm going to be talking to her later today because there's been some changes in her father's behavior. And she said, Kim, I need to talk to you. So we're going to talk later today. But I was able to connect her with some resources. And one of the resources is actually Tina Costa from Arcadia Home Care and Staffing. So we made that connection, but she's also checking out two other home care companies. And we understand that because in our business, we always talk about referring three. And so that's really a good idea that this caregiver is checking out three different companies to see what is the best fit for her company. But Tina's going to be on today, and we're going to be able to talk a little about the caregiver situation and just see how that goes. So if you're listening and you're at that gym, just hang on. We're going to be with you during the show. This is going to be a fabulous show because we're going to be talking also about integrative care, and Dr. Ben's got a demonstration for you. So I love when Dr. Ben comes on because he always does a demonstration. Last time he had me on a basu ball balancing, and I wasn't feeling well that day, but I did it. I hung in there. I did my balancing act. But today's going to be something different. So I love when he comes on because he's always got some great thing up his sleeve. And Tina Costa has great advice about integrative care for you at the loved one who needs the care. How are we going to take care of you, maybe at your home, in assisted living, maybe in rehab, or even a hospital? So Tina's services can be anywhere. They're so transportable. That's because her staff has been so well trained, and she's going to talk a little about that as well. So if you have any questions, we want you to call us toll free at 1-877-897-8255. Again, today's show is going to be Live Your Best Life, Benefits of Integrative Care. And I'm going to bring on Tina very quickly to say good morning. So Tina, welcome back to the Caregiver Hour.
Hi, thanks, Kim. It's good to be here.
It's good to be here too. How was your weekend?
It was wonderful.
Good.
It was really, really good. It was relaxing and spent time with my boyfriend, who I love very much. And yeah, we had a good time.
Good. Did you watch the Golden Globes?
No, I did not, but I started early this morning looking at little snippets from it on Entertainment Tonight and stuff like that. I heard it was really, really good. But I already told Charlie we are watching the SAG Awards next Saturday, so I booked him for that.
All right.
We're good.
Well, they were a lot of fun. And here's another way for caregivers you could TiVo it if you can't watch it while it's happening, where there was a lot of fun on that show. Tina Fey and Amy Poehler were just fabulous.
That was some of the snippets they were showing, the jokes that they were doing.
They were good.
So it was cool.
They changed the outfits, so you got the fashion going on. And I would say that Lorne Michaels had to be the most proudest person in that crowd because so many people from SNL were on there.
Yeah.
And they won awards. And so that's due to him, I would think. A large part of their career started with them. So we're going to have you come back, and Tina, you're going to be first up, so we'll be excited about having you back. And we want you to stay tuned. I'm Kim Linder. You're listening to the Caregiver Hour on 1250 WINS WHNZ.
Caregiving has gotten harder and more complicated, even as families have more and more demands on their time. That's why AARP is here to help caregivers with the tools, information, and support they need to care for their loved ones and themselves. Check out aarp.org/caregiving to connect with other caregivers like yourself and find the resources you need. Visit the AARP Caregiver Resource Center at aarp.org/caregiving.
Injured in a car accident or suffering from back and joint pain for a while? Clearly, you need to see a doctor. Call Dr. Ben, a chiropractor with 25 years experience. He listens, he cares, he gets results. His common sense approach? Coaching patients to be self-sufficient and less doctor-dependent. Let's face it, there are many things you can do to improve your health. Call Dr. Ben at 727-488-8044. Mention the Caregiver Hour radio show for a free examination. 727-488-8044. Dr. Ben, your coach to better health. 727-488-8044.
Sometimes I know what I want to say, but just can't find the words.
Last week I shouted at my grandson, and I'm not sure why.
I saw my daughter, but couldn't remember her name.
The sooner you recognize the warning signs of Alzheimer's disease, the sooner you can do something about it. To learn more, go to alz.org/10signs. That's alz.org/10signs. A message from the Alzheimer's Association.
Caregiving can be an overwhelming and stressful experience. Aston Gardens, Tampa Bay's premier senior living community, is excited to be able to support those who care for others. Please join them the third Thursdays of the month at 5:30 p.m. to learn creative problem-solving techniques and caregiving ideas from others who have been in your shoes. Aston Gardens specializes in independent living, assisted living, and memory care. Chosen for the third year in a row by the U.S. Commerce Association for the Best of Tampa Bay Award in residential care. Call 813-855-2811 or visit astongardens.com for more info.
Your home is where you feel relaxed, safe, and secure. Arcadia Home Care understands that you want to maintain that freedom and independence, even though you may be recuperating from an injury, illness, or simply require a little support with daily activities of living. You create a plan for your life as you envision it, and you can rest assured Arcadia will provide companionship, personal care, housekeeping, shopping, and errands, or whatever you need. They deliver their services with compassion, dependability, and professionalism. Their caregivers are screened, bonded, and insured, and must meet rigorous hiring standards, so you are confident you're receiving the best care possible for you or your loved one. Visit ArcadiaHomeCare.com or call St. Petersburg at 727-579-9414 or Tampa at 813-651-1300 to schedule your free in-home assessment and learn how Arcadia can enhance your quality of life while helping you stay at home and healthier longer. Arcadia Home Care, providing quality services since 1978.
The Caregiver Hour on 1250 WINS WHNZ. It's about taking care of yourself while you take care of others. Here's your host, Kim Linder.
Hello, and welcome back to the Caregiver Hour radio show. Are you a caregiver who maybe has noticed some changes with your parents, and maybe it's time to take away the keys or even have that conversation? If you are, we want you to call the Caregiver Resource Helpline today. And that number is 1-877-897. I'm so sorry. That's the radio station number. You can call me, always here, but you really want to call the helpline, and that's 1-877-552-4950. I had a senior moment there. Again, that number for the resource helpline is 1-877-552-4950, and you can also see it on the Caregiver Hour website. So the caregiverhour.com website has a tab called Services, and if you look down on there, you will see the helpline, and you can connect with us ASAP. And that's really going to be helpful to you. So I want to really get back to our guest. Our guest is Tina Costa. She is from Arcadia Home Care and Staffing, Area Director. So it's wonderful to have you here, Tina.
Yep, this is great.
Good.
This is good. I feel like it's all about Arcadia right now.
It is all about Arcadia. You've got the spotlight.
That's good.
It is good. I want to know, I called you about, you got a few referrals last week, and the last one really came through the helpline to me.
Okay.
But she really wants to know how you can help her dad, who's at home with her mother, who's really having some changes now. He really is, I think that he's feeling agitated.
Okay.
And there could be some memory loss. And she's talking to the doctor, their regular physician, but I'm thinking she needs to go further with this. And she agreed, and she was really happy to hear me validate that.
Right. Well, I think starting with your primary is a good place.
Yes.
That's like first. And then at that point, if you're looking at some sort of memory challenges or something,
yes,
and
confusion.
you're thinking it's more than just, the normal aging process, then you really should see a specialist, a neurologist, and get a definitive diagnosis one way or the other.
Right. And I think that you can go back to your doctor and ask, this is what I'm noticing with my dad.
Right.
Who do you recommend?
Exactly.
But I also think it may be time to do some memory screening. And at Morton Plant has memory screening area.
The Alzheimer's Association.
The Alzheimer's Association, and also USF. So there's a variety of places. So I'm hoping that you're listening to my caregiver person. I don't have permission to use your name, and I won't do that without it. But I just want to let you know that this is really what we recommend, that you go back to your general physician, talk to them about your dad and the behavior over the weekend, see that it was a change, and then we certainly want to help you connect with the other resources. So.
Right, because as we all know, and I've learned this from years of being in the business, that sometimes it's other things that can contribute to behavior changes and memory issues and things like that may not be, quote unquote, the worst case scenario. Right. It may be an adjustment in medication, nutrition, who knows?
Right.
An infection possibly going on somewhere, which we don't want, but it's actually, that's something that can be cured.
Right.
Hopefully, and then the changes and everything goes back to normal. So that's why you want to know for sure what you're dealing with.
Well, I think this is a great segue into integrative care and how that relates to Arcadia. So did you want to talk a little more about that, Tina?
Yeah, well, I think it was... when I heard what the show was going to be about, I had to sit down and come up with the questions that you were going to ask me. At first I was like, okay, well, where do I start? And then I realized, we do this all the time.
Yes.
It's just, we don't talk about it a lot. But for home care to truly be effective, it has to be a holistic approach. It really does. Mind, body, spirit, the whole thing. Now with different clients, different things are a priority,
right?
Obviously. So, but I think it's a matter of, the key things that we do are making them feel safe, keeping them healthy, keeping them independent and strong so that they can remain where they want to be for as long as possible. That could be as much as nutrition, making sure that we're cooking really good meals for them, that we're following whatever their medication regimen is, reminding them to take their medications, if there's certain therapies that they're supposed to be doing. All of that is part of what we do. It's not just going in and taking a blood pressure and a temperature and then leaving. The private duty side I think is a little bit more involved than that.
Well, that sounds really exciting and relieving for the caregiver, because they want to know that you are having that integrative approach, because sometimes they just focus on one thing when really you can help them widen that approach.
It's adjunctive therapy. It's getting the best benefit from 4 or 5 different things instead of 1 or 2. But that's why I would say probably the assessment, the initial assessment we do when we go in and meet with a client and family is so important. That's where we actually engage and discuss, but also listen to what they're saying and write down that information so that we can put together an effective plan of care.
And I think you would also observe.
Oh, yes, definitely, especially dynamics between the caregiver, the client, their support person, because a lot of that is going to dictate to us where their needs are that maybe they don't even see, that a trained eye might pick up on a little bit better.
That's really great. How else do you combine the traditional treatments with natural or homeopathic therapies? How does that work as a balance?
Right. Well, we're not in the business of prescribing or, bringing new therapies, suggesting, but we will help ensure compliance with whatever their traditional physician has ordered, if they're seeing a holistic practitioner, if they're seeing a chiropractor like Dr. Ben. Yay, Dr. Ben. And try to, what him and I were just talking about was when he's going over therapies and things like that with his patients in the clinic, that it makes sense to have a caregiver there with family member potentially to learn how to do all of that, so that when our caregiver is then taking care of his patient, our client, we can reinforce that and help them at home. So it's a consistency that's there.
Well, how empowering that is. I'm so glad we made this connection for the two of you. I've been waiting for a few months.
We're already going to do lunch. We already got that planned.
That's great.
Yeah.
But I'm glad that you thought ahead by having made this introduction. There's a reason why I put you guys together, that you can work together to help holistically the caregiver and their loved one, their family member.
Correct.
So this is
and
very
sometimes
exciting.
it's as simple as it doesn't really require a lot of thought.
Right.
You know, if somebody likes to watch old movies or they like to listen to a certain type of music, they automatically feel better when they're doing that. So part of that assessment process is to find out what they like, what they don't like, and match a caregiver to that need, which is important.
Well, we want to talk about that, Tina, because that's your specialty, is how you match the caregiver for the family member who needs the care.
Right.
Tell us a little more about that, because I'm thinking my caregiver who's working out is going to listen to this.
Well, something we offer that's very unique, not a lot of other companies do. I know they have tried. It can be challenging scheduling wise, but we let our clients pre-screen their caregivers. So once my director of nursing goes in, does a thorough assessment, meets with the family, meets with the client, comes back to the office, she gives all that data to our schedulers. We look at that, compare it to what caregivers we have available, who's going to be a good fit, days, times, clinical skill level, interests and hobbies. Can they cook, if they want home cooked meals, all of that. And then we may pick a handful and they get to interview them, which they don't pay for anything, Kim, until they if they start services with us. So they kind of have everything to gain and nothing to lose.
Yes.
I think is a good point.
Well, we want to know how they can get in touch with you. They certainly can get it through the Caregiver Hour, thecaregiverhour.com, our website, because your link is right there on the sponsor page, but also through the helpline. Again, that number is 1-877-552-4950, and Tina is right there at the top where you can connect with Arcadia right away.
Okay.
But if someone wants to call your office and maybe speak to Jackie, what's the number directly?
Absolutely. They can speak with Jackie or Tammy or Sue.
Okay.
That's my A-team in there.
And
the
what is
phone
your phone
number
number?
is 727-579-9414.
And tell them that you heard Tina on the Caregiver Hour along with
Absolutely.
Kim. That'll be great. And Dr. Ben. It's the whole family. So thank you so much. We'll have you come back at the end. I have a question from a caregiver for you, Tina.
Okay.
And Dr. Ben, we've got you up next. You're the common sense doctor. We can't wait. I'm Kim Linder. You're listening to the Caregiver Hour on 1250 Wins WHNZ.
This is the place to hear the Schnitt Show in real time. Hi, Schnitt here. Join me live this afternoon, 3 to 6 on 1250 Wins WHNZ.
Looking for high-quality supplements at affordable prices? Visit Gulf Coast Nutrition, located in Palm Harbor at the corner of Alternate 19 and Alderman Road. In the Publix Shopping Plaza, you'll find all your favorite brands, like Renew Life, Doctor's Best, Blue Bonnet, and many, many more. You'll also find nutritional lab testing and many physician brand supplements, such as Metagenics, as well as your favorite sports nutrition supplements, all at competitive prices. At Gulf Coast Nutrition, you get personalized service from a knowledgeable staff. Be sure to sign up for the free rewards program, available in-store at the corner of Alternate 19 and Alderman, or online at gulfcoastnutrition.com. Call 727-754-2900. Ready for a healthier you? Listen to Gulf Coast Nutrition with Dr. V and Brenda B to find out what supplements may be right for you. Gulf Coast Nutrition with Dr. V and Brenda B every Wednesday from 11:30 until noon on 1250 Wins WHNZ.
Hi, this is Dr. Michael Garka, host of Let's Talk Nutrition. Stay tuned to hear the show at a new time this afternoon from 1 to 3. I'll share the latest scientific information on how to look better, have more energy, age more successfully, and much more. Take charge of your health with Let's Talk Nutrition, now 1 to 3 on 1250 Wins WHNZ.
Are you looking for a deal on a foreclosed property? If so, please stop by my website, tampabayreo.com. My team and I work with 45 different bank and asset management company sellers and have hundreds of foreclosure listings in the area, and we are a HUD and Fannie Mae listing office as well. In addition, get a sneak peek at many of our pre-listed properties in the upcoming REO properties section. Let our experience help you get a deal today. Visit tampabayreo.com.
The Herbal Pharmacist Show is back and is better than ever. Tune in Tuesdays at noon on 1250 Wins WHNZ for a new format and better help for your health needs. It's the Herbal Pharmacist Show, Tuesdays at noon, right here on 1250 Wins WHNZ.
Overtime questions? Call 1-800-MORGAN-LAW. Morgan & Morgan, for the people.
This report brought to you by Florida Department of Transportation. AlertTodayFlorida.com. In Florida, 1 in every 4 traffic fatalities involve a pedestrian. Drivers, stop or yield for pedestrians and bicyclists. Pedestrians, always use a crosswalk. Bicyclists, obey all traffic laws. Alert today, alive tomorrow. A message from the Florida Department of Transportation.
From the Bright House Network's Traffic Center, we have a disabled vehicle northbound on the Veterans Expressway exit ramp to Waters Avenue. They're clearing an accident in Pinellas County on 5th Avenue North at 8th Street. Now there's an accident northbound on Seminole Boulevard at 106th Avenue North. And there's a wreck on Providence, south of Providence Ridge Boulevard. See traffic problems? Call the injury firm of Abrahamson and Uterwick Hillsborough Traffic Tip Line at 866-545-9595.
Mix of clouds and sunshine heading up to about 76. Then tonight we have fairly good chance of rain. In fact, about 80% chance, going down to 65. The rain will be a part of the forecast into tomorrow morning. Then a few breaks in the clouds. The high around 73 tomorrow. And tomorrow night, partly cloudy, cooler, down to about 53. Right now, 69 in Tampa, 66 in St. Petersburg. The Dow is to the red. It's off right now by 15 points. Now, 26 points make that. NASDAQ up 1.5. S&P 500 down 2. 1250 Wins WHNZ.
It's the Caregiver Hour on 1250 Wins WHNZ with encouragement, guidance, and support for caregivers. Here's your host, Kim Linder.
Hello, everyone, and welcome back to the Caregiver Hour radio show. We just had a great conversation with Tina Costa, RN and Area Director with Arcadia Home Care and Staffing, really talking about integrative care for the family member at home or in their wherever home is. But now we're going to go to Dr. Ben, who is our common sense doctor. He's a chiropractor and owner at Accident and Anti-Aging Clinic, and I'm so grateful that you're here, Dr. Ben. There are caregivers who are at home who are just burned out, or they want to take care of their loved one, but they don't know how. We want you to help them. And integrative care to me is so important. How can we help our caregivers?
Well, the approach to integrative healthcare is important because it's so much different. Can you hear me better?
Just speak a little more.
A little louder? Now I can hear myself.
Now we can. Okay,
right,
now
good.
we can hear you too.
The integrative approach is very important for all caregivers. Obviously, you want to help your patients at home or your person you're taking care of at home.
Yes.
You got to take care of yourself too.
Yes.
That's number one.
Yes.
What we're trying to do in our clinic is try to first, coming to our clinic, we want to give you a integrative approach. We'll talk about this, my definition of it soon. But then once we're done with the care, then we want to pass it on to you at home. There's so many things you can do for the person you're taking care of that are there, and you just don't know about it. So we teach you in our clinic what to do. Example, the Basu Ball we had you do.
Yes.
Well, we'll bring the patient in the office. The caregiver comes along. We teach you what to do. And then you take the equipment, inexpensive equipment, and you do it at home every day.
Is this something they could buy? Because I think I saw it at Dick's Sporting Goods.
Oh, it's all over.
Okay.
Ask
Target.
Dr. Google.
Okay.
Dr. Google, Basu Ball. You'll get all kinds of prices. Just get one that way.
Why don't we spell the name of the ball in case someone is trying to get that done right now?
BOSU.
Okay.
That's very simple. BOSU, Basu
Okay.
Ball. And it comes with a booklet of exercise also.
Okay.
So you can also balance training for the patients, whatever needs to be done.
So it's equipment you can have at home.
Correct.
Okay, good.
And today we'll talk about another technique that you can do at home too. You just need a little bit of training. So when you come to our office, we'll train you on what to do. It's called kinesiotaping. And we'll have a demo. We'll take somebody's wrist in the office here, and we'll do a taping in case you have carpal tunnel syndromes.
Well, we have John here who has volunteered, John from Tampa Bay Multimedia. He's going to, why don't we do the demonstration right now?
I need to prep it first.
Oh, you need to prep it.
This is what the tape looks like.
Okay. That's great.
Very simple tape, elastic tape. There's different sizes, different length we can do. It just, you can cut to customize
All right.
the joint you're about to tape.
Okay.
But we'll tape his wrist today. So when we have a intermission, and I'll tape it
Okay.
and we'll bring it back on.
All right.
But let's talk about definition of integrated medicine.
Yes.
I'm going to ask you questions. I want you to answer me truthfully.
Me?
Yes.
Okay. I didn't know I was going to be on the spot. I'm ready.
No, I'm going to put you on the spot right now.
I'm ready.
All right. Do you believe that medical doctors can cure everything?
No.
Oh, that was quick. Do you believe that a physical therapist can cure everything?
No.
Now be careful. Do you think that a chiropractor can cure everything?
I'm not sure.
No. Well, the answer is no. But I'm telling you this. If you go to a place, a clinic, to where you have a medical doctor, you have a chiropractor, and you do physical therapy, do you think you have a better chance to take care of problems?
Yes.
Well, this is what integrated medicine is for me. This is what we do. This is what our clinic is. I am a chiropractor, and I love my profession, but I realize that we can't cure it all.
Right.
So I brought along a medical doctor. We have a great medical doctor with us. We do full physical therapy in our clinics. We do everything we can do possibly to help you. And once the patient come to us, I'm a little bit different than most other chiropractors because I don't take care of patients on a month-to-month basis. If you come to me, I want to treat an injury, I want to treat something that you're hurting, and I want to get rid of you after that. So you come to us, you're going to see our physicians, you're going to see me as a chiropractor, we're going to do some physical therapy, we're going to do some exercise program, we may do some kinesiotaping, we may do some injections if it needs to. The doctor will prescribe you some anti-inflammatory if it's needed. Whatever you need, we have it there right now at our disposition. And that allows us to take care of you a lot, I wouldn't say better, but more efficiently.
Okay.
All concurrently in the same office, in the same visit. Once we're done with you, we teach you what you need to do to stay away from us. We'll talk about nutrition. We'll talk about exercises. We'll talk about balance training. We'll talk about possible kinesiotaping as well.
You know, the nutrition really was the piece that was missing for me. So I'm so glad you brought that up because I think the holistic part would be definitely the nutrition as well because there may be some weight from, the doctor may do some blood work and find out that there are some areas that need some help. And I would think the nutrition would definitely be helpful.
Well, not only the nutrition for this, but do you know that you are responsible for what you eat, and you may even cause 50% of your inflammation, 50% of your pain, but just by what you eat.
Right.
So if you don't know, and nobody tells you, well, you're stuck.
Right.
You're stuck suffering for weeks for no reasons. So the integration of all of that, all the surrounding care, is what makes us a little bit different than most people. But that really is the common sense approach. That's what it is.
That's really, I'm so glad you put it that way because the visual that was coming up for me is the caregiver who is watching their loved one have balance issues or maybe falling. They would be a perfect couple to come and see you. Would you agree with that, Dr. Ben?
Absolutely. They need to be trained. They need to know how to do it.
Right.
And we even offer people, come to our office. I mean, no charge. We'll tell you what to do. If you have a person you want to take care of at home, you don't know what to do, if it's a nutritional advice, or if it's just a little training on a joint. Let's say you have a shoulder problem or you have a knee problem. You would like to do the kinesiotaping, bring your patient or bring yourself. If your patient can't move, bring yourself. I will personally tape your knee, and I'll show you the technique. I'll show you where to buy the tape and go back and do it to that person. Absolutely no charge. So it's amazing what we can do, how we can teach. It doesn't take me a whole lot of time to teach you, but you just need to know what to do. And once you know, that's it. We're done.
So the best way for people to reach you, and I have a caregiver question as well, but the best way people can reach you, they certainly can reach you through the caregiverhour.com website. Go to the list of sponsors and also on the helpline, which is under services on our website. But they can also connect with you right by calling the helpline, and that helpline is 1-877-552-4950, and you're listed on there, Dr. Ben, and they can connect with your office right away. What is your phone number in case they want to visit you or see you at your office?
We're in Clearwater, and the phone number is 488-8044.
And where are you located in Clearwater?
On South Missouri in Clearwater.
Okay, that's very centrally located.
Pretty much, we're centrally located in Clearwater. We've been there. This is our first clinic. We have big goals.
I know.
I want to change the healthcare system the way it is right now. I don't like what I see. I had a good vision, and we talk about the vision that I had, and this is the first one, and is fully an integrated healthcare facility to where anybody can come in. If you have any questions, doesn't matter what you have. If you don't know about nutrition, you need some guidance. We'll tell you. We'll tell you what to do.
So you do a free consult. Is that what you're saying?
We do free consult with anyone that walks in. Or calls in and say, hey, I heard you. I want a free consult with the doctor and see what I can do. We have a special days. We do it on Wednesdays.
Okay.
And if you don't call, you just want to walk in, that's fine too. On Wednesdays, we'll have the medical doctor there. I'll be there.
Okay.
And
Great.
We'll answer your questions.
Well, again, give them your phone number in case they want to make a call, and tell them they heard you on the Caregiver Hour.
It's 488-8044.
That's wonderful. We have podcasts so people can listen to us after the show, and also the web archive so they can also meet you. Because sometimes when they see you, they may feel like, Dr. Ben looks like a nice man. I think I'll be okay going there. I think that's a good idea. So I'm so glad you're with us today. A caregiver asked a question. Is getting an adjustment painful?
Well, it should not be painful.
Okay.
That's the clue. There's so many different techniques. Now, I'm certified into 17 different chiropractic techniques of adjustments.
Okay.
And I will find the one that's not going to cause pain. It shouldn't cause pain. Give you an example. We had a car accident patient that came in, had severe neck pain.
Mm-hmm.
I'm not going to go in there and start manipulating their neck. We'll do everything we can to minimize the pain, reduce the inflammation first.
Okay.
Once the neck can move without pain, then we start doing the manipulation. But it's a non-painful technique that we use. At first, we'll do kinesiotaping. We'll do physical therapy on them. The doctor may prescribe them some pain medications or some anti-inflammatory medications. So we're doing the right thing at the right time. The adjustment should not be painful, should not be, you shouldn't be feeling sore for 2 days after this. And I've heard it so many times in my profession, says, oh yeah, you'll be painful, it's normal, you get first adjustment. My opinion, no. You should develop different techniques, different approach for the condition that presents to you.
I there were two things that you said that really made me excited. One was about the tape, because I just remembered that someone over the weekend mentioned the tape this weekend about some pain they had on their shoulder, how they use the tape. But also how you say you help reduce the inflammation first, and that makes so much sense rather than just going in and trying to manipulate.
Well, it does. First of all, if you adjust somebody
if
with
someone
inflammation,
is in
it's painful.
pain, they're not thinking, they're afraid to go see you because they think they're going to maybe be in more pain. You're telling them, and I'm telling you from a perspective of a caregiver, what you're saying makes a lot of common sense, that you're going to help with the inflammation first.
Absolutely.
Okay, the swelling.
Any injuries you have, this is the first thing you got to look at.
That's great.
And that's what the physicians are there to prescribe some anti-inflammatory drugs.
Okay.
So I'm a doctor, so that's the first thing to do.
Right.
And
that makes a lot of sense.
And the combinations of what we do is remarkable.
Okay. I love that. Well, thank you for doing that.
Well, you're welcome.
And then when we come back, you're going to show us about the tape, right?
Yes, I'm going to tape.
You're going to prep it?
I'm going to tape John's wrist. Once
All
it's
right.
the final product, you'll see what it looks like, and we'll talk about the function of it, which is kind of fun too.
Okay, terrific. And then we're going to have Tina Costa, who is who's an RN and area director from Arcadia Home Care and Staffing, answering a caregiver question as well. So stay tuned. We want you to be with us. I'm Kim Linder. You're listening to the Caregiver Hour on 1250 WINS WHNZ.
If you or a loved one experience bladder control problems, here's important news.
For more than 5 years now, the nice ladies at the Caregiver Partnership have taken the time to understand my needs, suggest the best choices of bladder control products for me, and always get the right product delivered to my door fast and with free shipping.
To get started, simply call 800-985-1353 for your free catalog and $60 in coupons. Many people just like you trust the Caregiver Partnership for convenient home delivery of bladder control products, and they have more than 500 to choose from. Call now. The call is free, shipping is free, and your satisfaction is guaranteed.
The Caregiver Partnership treats me like family and really knows their stuff, and they keep my business private.
Call 1-800-985-1353 now to receive your free catalog with $60 in coupons. That's 1-800-985-1353. Call now. The voice in the preceding advertisement is not the voice of an actual customer.
Injured in a car accident or suffering from back and joint pain for a while? Clearly, you need to see a doctor. Call Dr. Ben, a chiropractor with 25 years experience. He listens, he cares, he gets results. His common sense approach? Coaching patients to be self-sufficient and less doctor-dependent. Let's face it, there are many things you can do to improve your health. Call Dr. Ben at 727-488-8044. Mention the Caregiver Hour radio show for a free examination. 727-488-8044. Dr. Ben, your coach to better health. 727-488-8044.
Enjoy life at the Barrington, Largo's premier senior community. The Barrington, the resort lifestyle you deserve at a price you can afford. Life at the Barrington is truly senior living at ease, complete with chef-prepared meals, an activities director, and transportation to your favorite spots. Independent and assisted living homes are available now by calling the Barrington at 727-217-5681. Call the Barrington at 727-217-5681 to schedule your tour of their pet-friendly senior community today.
Hi, it's Kim Linder from the Caregiver Hour. I want to tell you about an attorney in Clearwater that I have known for over 7 years. His name is Bill Rambaum, and I have referred many families to him for his legal expertise. Bill is one of less than 100 attorneys to be evaluated by the Florida Bar and become certified as a specialist in elder law. His 30 years of experience and impeccable credentials make him one of the most highly regarded legal experts in our area. Give Bill a call today at 727-781-5357 or visit rambaumlaw.com. Non-attorney spokesperson.
Family caregivers, it's new and just for you. The Caregivers Resource Helpline, a free service brought to you by the Caregiver Hour radio show. If you've got questions about anything related to caregiving, you can call the helpline 24 hours a day, 7 days a week. Speak directly to dozens of caregiving experts on topics like what to do about caregiver burnout, how to best protect your family's assets, when to keep your loved one at home, or get assistance with a managed care facility, and much, much more. You can even speak to a caregiver coach. Call the Caregiver Resource Helpline today at 1-877-552-4950 to help you take the stress out of caregiving. The Caregiver Hour on 1250 Wins WHNZ. It's about taking care of yourself while you take care of others. Here's your host, Kim Linder.
Hello, everyone, and welcome back to the Caregiver Hour radio show. Are you a caregiver who's losing sleep? Maybe you're not eating right, and maybe you stopped exercising well. You want to call the Caregiver Resource Helpline because I can help you. I've been there, done that, and I really can be a best friend to help you get back in touch with creating that balance in your life. So again, that helpline number is 1-877-552-4950, and I'd be happy to help you as the caregiver coach. I have Tina back. Tina's still in the house, everybody. So it's a happy place.
You can't get rid of me, Kim.
I love it. And Dr. Ben, we're so grateful that you're here today, the common sense doctor. And I'm so glad the two of you met because I could see that you're two powerhouse people who really are committed to helping caregivers. And we really appreciate you being sponsors and really experts here. You know, I created that resource helpline so that the family members go to one place to get all the information. I've spent time with you. I know who you are. I know that even Gail, my assistant, went and had some care with Dr. Ben. And so, I just feel like for caregivers, this is where you want to go. That helpline is your main resource. It's your go-to place. Again, that toll-free number is 1-877-552-4950. And I take calls all the time, including the weekend. So I want to certainly give us time to answer to do the piece that Dr. Ben wanted to do about the tape, and then Tina will get to you. And then I have a little thing about nutrition that I brought for caregivers. We need to have snacks, healthy snacks, and I want to show you. I brought my Arcadia bag. Mm-hmm.
You're so good.
My beautiful Arcadia bag that I tote around with me with my wonderful snacks, and we're going to talk about this before the end of the show. So stay with us. So Dr. Ben, show us about the tape.
Okay, before we show the tape, I'm going to tell you what you're going to be seeing.
Okay.
You'll see the tape applied to the wrist, and I'm going to demonstrate a little bit of function, what we use a tape for at that point. So let's have that wrist coming up.
John's arm, yes.
Okay, good. Now, what that represents is the tape is helping the motion of the flexion of the wrist. It's also trying to stabilize the wrist not to flex too much downward at the same time. It helps support that joint. And I've used that tape for carpal tunnel syndrome, and I tell you, it will replace the wrist brace. Now, I do recommend the wrist brace at night to be worn, but during the day, you need to have your wrist functionable, and a lot of people wear that wrist brace, but you can't use much of that hand if you work on the computer or if you work with your hands a lot or your mouse. The tape will help stabilize the joint and prevent further aggravation of the condition.
So have the tape on during the day while you're doing your work.
Absolutely, during the day. Not only this, but you can wear the tape for 2-3 days at a row. You take it off, or if it peels off by itself. And it's so much nicer that it gives you freedom of motion at the same time that you're helping your condition or try to treat the condition. Now, obviously, the tape is not going to cure carpal tunnel syndromes, but it's going to definitely help to prevent the aggravation of carpal tunnel syndrome.
Well, that's that holistic approach again, is the preventative. So I was
Correct.
thinking about that. So some people may need surgery.
Well, my experience
Tell
in
me.
the last 25 years,
Yes, you're the expert.
carpal tunnel syndrome is preventable, and we can all not only prevent it, but once it gets to a point that you need therapies, the way our approach, the integrative approach, our success rate so far is 85%.
That's wonderful.
To prevent surgeries. So we still got 15%
great.
of the population will
That's
still need
right.
surgery.
That's right.
They will still need the surgery,
Right.
but if we can get to them before they get to surgeries, we can prevent a lot of them.
That's wonderful.
Not only we can prevent a lot of them, but then we teach the patients what they can do to prevent this from coming back. Because that you have therapies for your carpal tunnel syndrome, you have surgery for your carpal tunnel syndromes. If you don't change, if you don't learn what caused it the first time, you're going to get it back.
Okay.
I had a patient that came to me and says, I had 4 successful carpal tunnel surgery on the same
Wow.
hand. I says, okay, if it was successful, it should have been the first time,
Yeah.
right? And not have to surgery again. But the fact is if you go back and redo the same thing you used to do, what's the chance it comes back?
Right.
So then the common
Makes
sense would
sense.
say what? Well, let's just not do that again and try to know what to do. Or there's some exercise you can do also to prevent all this from reoccurring once it's fixed.
Okay.
But as soon as you start having some pain in your elbows, that's once you start having tendonitis of the elbows, that's the first time that I see, okay, you're getting down the line to eventually get carpal tunnel syndrome. And that can be prevented.
How can they reach you?
488-8044.
That's in Clearwater, so that's 727 in case someone is out of state.
Correct.
Okay, we want to let them know that. You also can connect with Dr. Ben right on our website, thecaregiverhour.com, through our helpline, which is right there under Services tab, and you can connect with him right away and make that appointment and just tell them that you heard it on the Caregiver Hour.
Absolutely. Thank you so much.
Thank you so much, Dr. Ben. So, Tina.
So, Kim.
What do you think? This has been interesting.
It's been very informative, actually.
Yes.
I'm kind of loving the tape thing.
I know.
Over there.
I know. Me too. I've never seen it before. I heard about it, but I've never seen it. So thank you so much, Dr. Ben, for bringing it on the show. And if you want to connect with us, you certainly can do that through Facebook, Twitter, and LinkedIn. But if you want to connect with our sponsors, just go to our website, and they are all listed there for you. So, Tina, tell me, I had a caregiver get in touch with me, and they asked about I'm just reading the question because I want to make sure I get this right. What happens, because they listen to the show, they hear me talk about balance, is there a way to help the caregiver create balance when you're there with the loved one?
Absolutely.
Tell us how.
Well, probably the first question I would ask if this were something where I was engaged in the conversation
Right.
with this person, I would say, well, what do you do that makes you feel relaxed and happy? Is there something that you do? Is it online shopping? Is it going for a walk? Is it going to see a movie? And once we determine what that is, then we determine a path to take to get there. Whether that means having someone come in and take care of the person that they're taking care of so they can physically leave and go and have some time to themselves and do whatever makes them feel good.
So you see how, our focus is always on the person who needs the care, but then if you turn around and talk to that family caregiver and say, how are you taking care of yourself?
Right, exactly.
They're going to be like, oh my God, this is so nice that you're even thinking about me, and
Right.
you are. But it shows that because the person who is the loved one getting the care, they want to know that the caregiver is also being taken care of.
Oh, absolutely. I mean, whether it's your mother, your father, your grandmother, your aunt, your uncle, whatever it is, I mean, they want whatever time they have with you to be quality time.
Yes.
If you're tired and you're not feeling well and you're irritable and you're not sleeping and you're not eating,
Right.
that's not going to be quality time that you're with them. You need to take that little bit of time away. Doesn't even have to leave the house if you don't
Right.
want to, or the apartment, whatever the case may be. It's just putting that separation, that distance there long enough to refresh, rejuvenate. And like I said, for me, it's as simple as watching a movie. But for them, everybody, it's different. So, I mean, I think
Right.
where we come in is we can learn what you do normally while you're there. We do that for you so that you can feel safe in exiting from the scene for a short period of time.
That is so great because that's how I want to empower the caregiver. That's how I want them to create their balance, is to take that time. And you do such a great job with that. If someone wants to be in touch with you, how do they do that?
Okay, they can call 727-579-9228. 9414. That's our office number. And once again, you can speak with Jackie or Tammy or Sue. And even if it's after hours, on weekends, we have live on call. So you're not going to get an answering service. You're actually going to get one of them answering the phone.
That's wonderful. And we've had some events that we've been showcasing on our live web stream, and also services that Arcadia provides. You have packages now, correct?
They're phenomenal. What they are is it's like basically you're purchasing a block of time.
Right.
And it's per month, but if you don't use it all in one month, you can roll it over to the next month. But for what's nice about it is you design the package or we help you design the package that works best for you. You know, there's a lot of different services, but if you just need companionship or you just need housekeeping or you just need meal preparation or laundry, we do whatever you need for that amount of time.
Well, I love this because this really helps family members say, I want the bronze package, I want the gold package, I want the platinum, and really know what they're getting.
Correct. And a couple of questions.
And customize it.
Exactly. And a couple of questions that have come up recently while I'm out there promoting it is, okay, well, again, what if we don't use all the hours in 1 month? Absolutely. You can roll it over to the next month. A lot of them ask because we do promote the fact that we do a free registered nurse and RN assessment every time we meet with someone, whether we start them on service or not. So a lot of them was that part of that 8 hours or that 24 hours. No, I said, that's on top of. That's above and beyond. So once we go through the assessment process, we go through the caregiver identification, you pick and choose who you want. That's when the clock starts on your package. So it's really nice.
That's great.
Yeah.
All right. So I want to thank Dr. Ben for being here with us today, and certainly Tina Costa from Arcadia Home Care and Staffing. Dr. Ben, you're the owner at Accident and Anti-Aging Clinic in Clearwater. I want you to get in touch with our guests today and let them know that you need their help and they are there for you. So we're very grateful. Before we go, I just want to tell our caregivers that I want you to have some snacks with you today. Get some nuts. These are really healthy nuts for you. I got the unsalted. I cut an orange pepper. This is a great healthy food for you. You want to take that as well. And then, of course, you always want to have water, lots and lots of water. So I want you to take care of yourself this week, and we will be back again for you next week. I'm Kim Linder. You're the host of the Caregiver Hour on 1250 WINS WHNZ. Have a beautiful week.
The opinion